So what I'm going to look at is just basically what is the coronavirus and a bit of how it works, what its effects have been, touch on things like, death, the big scary thing, how it spreads, kind of why we test, and what are these various different things around kind of social distancing, isolation, this idea of containment versus mitigation for where we are in at this stage. And my understanding of how those terms, what those terms all mean, to help us understand why we're doing now what we're doing, or from our individual homes. And then we'll open up for other questions that maybe we can take forward and feed back to participants, or if the things that you need to correct me on, then just go for it. Okay. So this is one of the early little information, just about a minute information thing around the coronavirus.
So coronaviruses are a group of viruses that are found in humans and animals and have been really known since the 1960s. In humans, there are 4 different coronaviruses that cause normal disease in humans, really like colds and flu. And these viruses have been around for a long time. You also find these viruses in many different types of animals. Now, sometimes what can happen is that the coronavirus in an animal can change in some way and acquire the ability to infect humans and cause illness in humans. And usually when this happens, it causes a respiratory disease like pneumonia. And it appears that this is what has happened with this virus. Just interestingly, corona means crown, and the reason the virus is called a coronavirus is because it looks like a crown under the electron microscope. It has spikes on the surface, which it uses, in fact, to attach to cells and infect them. And so it looks like a crown or corona, which is why it has that name.
Okay, so the corona viruses, more of them, is one of a number of illnesses that can jump from animals to humans. I think the most famous one was the rinderpest, which people may have heard about, infecting cattle, centuries ago, that spread throughout cattle with farming, early farming in southern Africa, and that actually jumped into what we know as measles today. So these things can jump, and they are really part of the fact that we, live in a world where we're one animal. I mean, there are viruses or illnesses that jump from humans and infect animals, and vice versa. A virus, like a bacterium, like a human being, is any kind of little piece of DNA or code that's just its main aim in life is to reproduce and to survive. So it's not evil. It doesn't have an intention. We hate it all, but it's just another piece of. This is not. So viruses are different from bacteria because they're not actually living. So they're little bits of code, okay, RNA inside this cell here. That's main aim is to reproduce. Now, one of the important things about the structure of this virus is that these little bits that make up the crowns are proteins that stick out of the virus, and they're the bits that attach onto your cells and get into and infect your body. But the orange thing around here is a fatty membrane, okay? And so what a lot of things do, like soap, for example, so soap is on this side, which has got a tail. It's got one end that likes fat and another end that likes water. So we all know oil and water don't mix. The oil goes on top of the water. But soap, why it cleans your dishes, is that it's got one end that attaches to a fat and another end that attaches to water. So what happens is tiny particles of soap crack open this fatty membrane of the virus because the fat-loving part of the soap attaches to it, and then they pull it open. And in effect, they then surround all these parts of the broken up virus. And when you rinse your hands under water, it gets flushed away. So this is why the simple but magical ingredient soap is so effective as a strategy for cleaning ourselves. Obviously, you have to do that before, when you've got the virus on your hand, before you stick something into your mouth and whatever. Corona is a pandemic. Pandemic is an illness that spreads across a wide area, and in this case, right across the globe. So we can see here, this is a color-coded world map that shows the number of cases per 100,000, and it goes from less than 0.10 to over 20,000. There's some countries here that have not reported cases, but otherwise, and we know that there are more than 500,000 people in the world have got the virus, of which 23,000 odd have died. We all know, I think most of us know how it spreads. Okay, so the virus spreads by being in little droplets. So it's not spread by breathing. It is spread in droplets that come out of an infected person's mucous membranes. What that means, if somebody sneezes near you or on you, then some of those droplets could be airborne for a while. They're still droplets, but they might be in the air, like droplets of water from a steaming kettle that you don't see. Those might land on you, or you might inhale those. And that would be one way of transmission. Transmission being the virus moving from one person to another. The other big way is that someone coughs into their hand. The virus is obviously so tiny you can't see, and then they open the door or push open an entrance or whatever, and the virus can survive for a couple of days on those surfaces. Different surfaces have different lengths of time. Copper is, interestingly, one of the surfaces that disrupts the virus. Cardboard and things like that, it doesn't last, but shiny, polished surfaces like steel, the virus can stay for a couple of days. Okay. Compared to the 500,000 cases in the rest of the world, Africa at the moment appears to be relatively slow to have transmission of the virus. This is, as you can see, because everyone will know that that statistic for South Africa has moved. But if you look at this, this graphic was as the case as of March the 20th, which is not long ago, only a week. So we can see how quickly things can change. Okay, but nevertheless, compared to 80,000 cases in China, we in Africa are still at the very early stages of the pandemic. This is the kind of statistics that you can look online quite easily. It shows, if for those of you who are interested in tracking, so where we started in China with, which was at first just a contained geographical area that quickly spread up to 80,000 cases. And then Europe became the epicenter, the center of where the virus spread to because of international travel, with Italy and Spain being particularly hard hit. But of course, around March, it moved into the US, and the US is now the most, has the most numbers. I haven't gone up one. So this case here gives you the total number of cases per 1 million in the population. So you can see obviously smaller countries where people are more closely together have a higher per unit caseload. In China, which is a huge country, I mean, that 81,000 translates into 56 cases per million of the population. So this kind of thing, for those of you who are obsessed with the news, you can get on quite easily, and it updates every day, showing the new cases. So the US is going at about 17,000 new infections per day and about 270 new deaths per day. In contrast, South Africa, down here at the bottom, I hope you can see my cursor, is sitting at about an extra 200 a day. This number, I was just saying how, touch wood, we were still, even though we were in nearly 1,000, we have had 2 deaths reported. And so for our new update of today, this number has gone to over 1,000, and 2 deaths have occurred both in the Western Cape. Nationally, this just shows our statistics. The blue graph is the previous day, and the red graph are new cases. And a friend of mine, Chris Gifford, is keeping this statistic going, and you can look at him on Facebook, and he's publishing these every day, just so that we know what's going on. He does it per provinces. Yeah?
Georgie, can we get a link to that?
Yes, I'll send that. I'll send that link. Per province, you can see that Gauteng, these graphs have a y-axis of 0 to 500. And so you can see that Gauteng is sitting at over 400, the Western Cape second with over 200, and then KZN 100, and the Free State. So the bulk in obviously our most densely populated province, Gauteng. And then these are the minor provinces for now. With the Free State, you can see a highish number, and that was all up to around 50, all related to that big, the foreigners coming in for a big Christian prayer service on about the 6th of March. So, just one thing to know is that the illness, the virus spreads whether you are symptomatic or not symptomatic. So if you are symptomatic, it means that you've already developed the symptoms, which include usually a dry cough, not a very productive cough, let's say, a headache and a fever. Some people say that, or some of the scientists say that there's a loss of taste and smell are kind of early signs, but that's usually the thing that accompanies most flu, so it's not necessarily an early diagnostic feature of the virus. But even if you don't have symptoms, and this is the one thing that differentiates the COVID virus from like Ebola, is that Ebola would only transmit in very close contact between people and when you were infectious. This can transmit even if you don't even notice your symptoms. And in the case of young people particularly, it seems to be that the virus does not produce hectic symptoms in them. And so that's why there's a greater danger of inadvertently passing on the virus without even knowing that you have it. Okay, so some people just feel a bit miffy, and then they get better. So yeah, so this would just be there's an Excel spreadsheet that accompanies these. So for people who are interested, I can send, they can look at that or follow Chris Gifford. I wanted to point back to this slide at looking at the number of deaths, because many people are saying, oh my God, we're so freaked out about this virus and it's going to kill us all. And that's when kind of panic sets in, and there's like massive panic buying of goods and so on. And in the United States, interestingly, the panic buying was not only of food and toilet paper and so on, but also, you name it, guns. So all the gun shops had this total rush on panic buying, because I think it's got something to do with the American psyche and feeling fearful and therefore going out to buy a new gun and all the ammo in the shop. That said, if you look at China, 81,000 cases, 3,000 deaths. And most of the cases that they have recovered. So 74,000 people have finished the flu, have recovered. Okay, they have about 4,000 people who are still going through that process. And so for this active cases, we obviously don't know whether any of those are going to end with the person dying or surviving. Okay, I mean, they have 1,200 of these that are critical. But if you compare it with Italy, Italy has also 80,000 cases, okay? And they don't even have, most of those are still in the process of being sick. They haven't got an outcome of health recovery or death, but they've had 8,000 deaths. So you can see there's a huge difference in the mortality between countries, and also between different age groups within a country. And that's something that, so when we think about how many people die, we need to bear in mind that the fatality rate, and you'll see lots of scary numbers, but the fatality rate it depends on a whole lot of things. And I just wanted to go through a few of those things so that it helps you to understand and interpret data that you'll see on social media and so on. Okay, so the first thing is that selection bias usually will mean that only those people with severe diseases are being tested. So we know that death rates are only from people who we know that had the virus, and we know the outcome. They survived or they didn't. But if we're only testing those who are really sick, then it means that all of those people who got it and have recovered are not even part of the data set. So it's only in hindsight where we have tested the population and government or health departments know about these, or epidemiologists, those that study disease, will be able to say what the mortality is. Okay. Obviously, if you're testing people on their deathbed, then you've got 100% those people who get the virus die. The more people who you test, the wider your testing, the more accurate you're going to be about what the real threat of dying is. The other factors that also then account for increased deaths. So we know in China, same with Italy, same all over the world, that 80% of those who die are sitting in the old category. The average age of the Italians who die, their average age is 78 years old. Okay, so old people are much more at risk than young people. In the under 20s, there's not been one death, okay, attributed to COVID. So, so age is going to change things, and then also, very importantly, healthcare facilities, and this is what's going to inform the second part of the talk. If you get very sick and you need medical attention and you can't get it, then that's going to up your chances of dying. Okay, so it's like if you have a heart attack and the ambulance takes 20 minutes to come and not 3, you're more likely to die from the heart attack. And then, so this word comorbidity, the fourth bullet there, in Italy, they are the country that's got the highest level of resistance to antibiotics generally for other illnesses and that, and they think that it's because Italians have got a whole lot of other kind of illnesses that may be related to smoking, so these comorbidities, the underlying illnesses that might affect the death rate or the fatality rate, are part of what one needs to take into account. Obviously, here in South Africa, we've, on the one hand, we've got a younger demographic, so that's very much in our favor. But on the other hand, we've got also some underlying illnesses like TB or pneumonia, and we don't know about HIV and how that affects the issue of resistance. And then also different countries have you can't say doctored, but have had a different approach to the way they report in the deaths. So somebody who was dying anyway happened to have the coronavirus, but was already dying of pneumonia or something like that. They die with the disease, so it's an association, as opposed to they got really ill from the disease, developed acute respiratory illness and died from that. Okay. So different countries have different approaches to how they compile their statistics. And that's going to affect what you read around the mortality or the fatality rate.
Geordie?
So far, so good. Yeah.
There's a question here about why is there so much difference between the province with the most confirmed cases, Gauteng, and the province with the least confirmed cases, Northern Cape? What is the Northern Cape province doing to limit the spread of COVID-19 that the other provinces are not doing?
In the early stages, and we are still in the early stages, transmission in our, I think our first good few hundred cases, only 15 of those were locally transmitted. The rest were all from people who'd been traveling abroad, caught it abroad, and come back. So if you look at the Free State, what sparked off any cases in the Free State was the fact that we had people coming from the USA, from Israel, to a religious convention and prayer thing, and they were carrying the virus with them. And so given close, so transmission is really about who you come into contact with. If your population is spread far apart and there's not a lot of mobility between with people, between people, then your rate of transmission is going to be slower. So if you think about Gauteng, it's the hub of the country. You've got most people visiting. It's a big international airport. So you've just got so much more traffic. Okay. So some of the the number of times that you are exposed to the virus is going to determine whether you pick it up or not. Right. So if you have a little exposure, at least in the beginning, eventually once it's in a population, then things like how closely you live together, what your local township or suburb, how that operates and what we do there affects transmission. Okay. But in the beginning stages, it's always been how many vectors. So a vector is an agent that brings it from somewhere else. How many vectors you have that come into contact with the population. Yeah.
Thanks for looking. If you have more questions on that, shoot them through. There was also a wonder about a reinfection, and I don't know if that's a good time to bring this in here or later, but just wondering
we can deal with it now. They don't know, but the feeling is that the way that most viruses behave is that once you have recovered from the virus, you have immunity built up in you. Okay. That's like how it all works. It might be that in a couple of cases, because I have read, and I don't know whether they confirmed 1 or 2 cases of reinfection, but the way all the modeling is going and all the epidemiologist sites that I've read assume that once you've had it for this year, it's like you have the flu shot and then you're not going to get flu. You might get flu next year or the next time round because the virus will mutate, it will change its attributes over time, and so you might get it again, which is why you get a different flu inoculation, a flu injection every year, the injection is different because they are busy working at what new strain of virus is coming in with the influenza virus. Okay. Now the flu virus is not nearly as it's as infectious, but it's not nearly as severe as COVID. But it is worth remembering that South Africa has a kind of a rapid response team that was set up around that was set up really to deal with the threat of Ebola. And it's a team of epidemiologists and kind of rapid response people that can be, that's not a standing organization, but can be called into operation by the Minister of Health. And they came into operation with Ebola, so they were busy. I mean, it didn't affect us in the end, it didn't come here, but they had a trial run of how to get their systems up and tracking and how does this all work. And then they used it in the Life Esidimeni tragedy to track patients from there. So they've had a few tests, but obviously, and they were called into being on the 3rd of January this year. So they had 2 months in a way to set their system up. But, you know, I mean, people say, oh, South Africa said we were prepared and now we're getting it. Like we could prevent it from happening. It's not going to be possible. Okay. So remind me what the question. Oh, so reinfection. It's all the models work on the fact that for this time you won't be infectious again, and that's where this idea of herd immunity. Some people may have heard the words herd immunity. This was the UK's initial approach. Oh, we're going to assume that a couple of people are going to get it, they're going to recover, and then they're going to be immune. And then the virus won't be able to won't be able to spread because they will be attacking people who have already got immunity. So that'll keep everybody safe. We did hear just now, before going live here, that Boris Johnson is sadly confined with the coronavirus. So he has become infected. So we wait to see what happens there. And I'll touch more on that a little later.
I wonder, maybe this kind of goes into that, just wondering about wealth and people who have got money and what it takes to treat. So Lisa was asking a question about why is it that there are more cases above the brunt line? Countries that are extremely wealthy, however, they aren't able to treat all the patients regardless of their age. How is it possible since they've got the money? So just wondering, why is it so rich, poor, thinking Boris Johnson and all the celebrities that are getting it as well?
Yeah. So I think that the virus caught people sleeping a little bit, and that the response was too slow and inadequate. And I'm going to look at, so the World Health Organization has been saying, test, you've got to test. And what they're really addressing that to is not individuals, they're addressing that to countries. Because more at the initial stage, which is where, say, we are, and where the US and the UK were only 20 days ago, more testing. If you could test everybody, for example, if you could just roll out testing, and with that, contact tracing, in other words, tracking. So if you can test people, then you can isolate the sick and you can stop infections from spreading. So that's first prize, obviously. So you get to test somebody, you immediately say, right, and you're sick. Here you go, you're in hospital, you know, or whatever, or you're isolated. And if you can be stringent about that, then you can nip it in the bud. So South Korea, for example, they implemented a massive testing program. So they have tested as many people as the US, right? They have 52 million people in their country, and the US has over 350 million, whatever it is. So per capita, They just like went straight for the jugular of test, test, test. Combined with that, they had a number of things which Western countries often feel are kind of curbs on my freedom of my individual rights and my freedom to choose and all the rest of it. So they use cell phone data. Their tracking was about monitoring where everybody was moving, who they came into contact with, contacting those people. So people would arrive home and on their door would be a note saying, you must present yourself for testing immediately, or you must first stay at home and phone somebody, they're going to come and test you. So that kind of thing of like really aggressive testing, drive-through centers for testing, allowed them to pick up and isolate before the community spread happened, okay? So that is really, when we're talking about containment, it's about being able to pick up, move to an isolation and treat. And that is the ideal. It obviously has the least disruption on society because everybody goes about their normal business, but you can spot your population who's got little red blimps on them, and you can pull them out and contain it that way. And so that's why South Korea has been the least affected. But the next step is and I'm going to show how that happens in the next slide, but the next step would be what we call mitigation, okay? So is what we do to slow down the spread, okay? And there are different levels of that, from social distancing or physical distancing or whatever the words we want to use, to a total shutdown. And that really is about slowing the spread. Of course, if we shut down and everybody obeyed it and we shut down forever or for a year, then we would not slow the spread, we would stop it completely. But of course, that's the kind of the juggling act that you have to do, right? So importantly, testing is for governments to work out what their strategy is. And whether it's containment, whether it's looking at how it's moving through the population, testing won't help you get better as an individual, okay? I wanted to show, I apologize for those who are scandalized at my showing Fox News, which is a rag, but it is an interview with a doctor, and it's worth just on the subject of testing.
Dr. Ashish Jha, director of Harvard's Global Health Institute. And doctor, thank you for your time. We may get interrupted here, but I'll try to get as many questions as I can, sir. Good afternoon to you. Dr. Anthony Fauci yesterday said this: I'd like it when people think we're overreacting because that means we are doing it right. How do we understand that and explain that to people now, doctor?
Yeah. You know, Bill, first of all, thank you for having me.
Sorry, Anthony Fauci is Trump's epidemiology advisor, for those who don't know.
So, Jordy, we just want to see the video, if you want to, if there's a video.
Oh, you can't see the video?
No. But we can hear great.
Okay. Sorry, you'll have to listen. It's just him talking.
In this country, we're really behind the 8 ball on this infection. It is spreading in communities across the United States, and it has a mortality rate that's 10 to 20 times worse than the flu. So it's a pretty serious problem that we have. And actually, Dr. Tony Fauci is completely right. My biggest hope is that we overreact. My biggest fear is that we underreact. The cost of overreaction is serious. We could have economic consequences. The cost of underreacting will be measured in human lives.
A couple more things.
And so we really have to act very aggressively.
A couple more things. He said an outbreak like this will overwhelm any system. That would include ours, doctor. How do you see that playing out as of today?
Yeah. Look, what's really clear from the data is that if we do nothing, American hospitals are going to get overwhelmed. We're not going to have enough beds. We're not going to have enough ICU beds, not enough doctors and nurses to take care of people. So hospitals have to get very aggressive in opening up beds, and people have to be very aggressive about avoiding getting sick and avoiding contacting others.
Doctor, the White House said on Saturday that of those tested in South Korea, 96% tested negative. So when you think about the millions of people people are trying to get direction on this. What do you say to them when that number is exceedingly high? I mean, thankfully so, but 96% negative, doctor.
Yeah, and what that means is in order to curtail the disease, you have to be testing lots and lots of people and then identifying everybody who's got a positive test and then isolating them. That's the strategy. It's kind of public health 101. But when you don't have enough tests around, you can't do that. And that's where we're stuck. We can't test patients in America. South Korea got it completely right by testing lots of folks and identifying the small number who are actually infected and isolating them.
A couple
Okay. Okay. Are you with me back? Yeah?
Yeah.
Okay, so Anne's given me a time note, so I know I'll move a little faster. So you can just see here that South Korea is here. It took off, but then they implemented this tasting when we were still at when they were still at a fairly low rate. And then on the other hand, these red lines are here, countries that haven't really been able to get a grip or to curtail the spread of the virus at all. Okay. I want to show you why does it spread so rapidly, and I will show this even though it's a few minutes, because it brings home the idea of exponential growth and what it means actually when we talk about a virus spreading through the population exponentially. Because many people say, oh, well, people die of, so many people die on the roads and there's so many deaths that like from violence and whatever. Why is this thing so dangerous if we do nothing?
This is the paradox of pandemics, and it's why with an outbreak like COVID-19, you hear health officials calling for huge, drastic, and rapid responses in the early days when infection numbers are still relatively small. Some people worry that these actions are overreactions. Sports teams playing to empty stadiums or not playing at all, canceling huge gatherings and festivals, temporarily closing schools and offices, telling people to avoid personal contact. Media sensationalism. But this way of thinking fails to appreciate how disease outbreaks work. It was really never fine to begin with, but we don't notice until it's too late. Hey smart people, Joe here. How bad will the coronavirus outbreak get? That's what we all want to know, and the answer is in one of these curves. This is what a rapid global pandemic looks like. Little to nothing to slow the number of new infections means a lot of people sick in a short amount of time. A slower global pandemic looks like this. The rate of new cases is lowered and they're spread out over a longer period of time. And which one of these paths that we end up on is important because of this line. It represents the capacity of our healthcare system, the number of beds, doctors, respirators, and everything else. What experts fear is
just to say in South Africa, not the number of beds, but the number of ICU units with respirators is around 1,000 nationally.
A sudden explosion like this, overwhelming this capacity. And what's really interesting here is that even if these two curves represent the same total number of people that eventually get infected, in the rapid outbreak scenario, more people will die because there won't be enough hospital beds or ventilators to keep them alive. This is a strange idea, that even if the same number of people eventually get sick in the end, even without a vaccine or a cure, taking drastic action before we see things get bad, that will save lives all on its own. What we're doing isn't overreacting. It's exactly what the science of epidemics tells us will work. And that's counterintuitive, because our intuition doesn't really get exponential growth. Instead of thinking about viruses, let's say you have a pond. And on the pond is a single lily pad. This type of lily pad reproduces once a day. So on day 2, you have 2 lily pads. On day 3, you have 4, etc. If it takes the lily pads 60 days to cover the pond completely, how long will it take for the pond to be covered halfway? The answer is 59 days. The area covered doubles from half to the whole pond on the last day. I bet some of you knew that though, because you're pretty smart. But on what day do the lily pads cover a mere 1% of the pond? Well, surprisingly, that doesn't happen until day 54. The pond is basically empty until it's very suddenly not empty. We go from covering less than 1% to covering the whole pond in just the final 7 days. This is exponential growth, and it's how pandemics work. We multiply today by some constant to get the value for the next day. The time doesn't have to be days, but that's helpful to use for something like lily pads. Our constant was 2, or COVID-19. Starting in mid-February, we've seen between 1.1 and 1.4 times more cases each day. A number over 1 tells us every day we're seeing more new cases than the day before. You can see the number of total cases starts to add up really fast. Exponential growth can be scary, but obviously this can't go on forever and fill the known universe with viruses for a few reasons. The virus will either infect everybody, like our lilies filling up the pond, or what actually happens is the virus stops finding people to infect, either by running into people who are already sick, or we isolate people who are sick, or thanks to something like a vaccine, spreading resistance in the population. But over time, the growth rate will naturally slow down, and we end up with a curve for the total number of cases that looks like this. This is called logistic growth, and we call this curve a sigmoid, which is a weird name, but luckily it starts with S, which also happens to be the shape of the curve. While I was working on this, this is the...
So you can see really how important it is where we are in now. In South Africa, we do not have the resources to be South Korea, to do the kind of massive rollout of testing that we would need to have an intervention like in South Korea. Already there's a backlog in testing, so the numbers that we see every day are actually a bit behind what there is. I think there's a backlog of about 5,000 cases, and in the state, and even more in the private clinics like at Lancet Laboratories and that. And part of that backlog is from people panicking and just wanting to go out and have a private, at 1,000 Rand a pop or whatever, have a test done to see whether I've got the virus. And the bad thing about that is that, one, it takes away test kits that are needed for people who are fit the risk profile. Secondly, you might test negative and then you think, oh yeah, cool. Okay, well, let me go out for that cup of coffee with my friend. But you might be in the very early stages of infection, and it also doesn't mean that you don't get it that time you go out for coffee with your friend. And lastly, is that it does jam up the system with unnecessary testing that's going to affect the government's ability, the epidemiologist's ability to understand the passage of this disease in South Africa and how to deal best with it. So don't let your friends just go out for testing. So this is now, and a bit too late. So somebody said, why haven't these other countries done anything? It's because they just didn't take it seriously enough. From Trump saying it was a hoax to it was the Democrats playing politics to, whatever, to Boris Johnson saying, how could we ever do away with that greatest of British traditions, going to the pub every night? They've not taken the advantage that they had from when the virus was still here in China of being able to put something in place. Okay, we've reacted. Our response was much quicker than a lot of the European countries, even though it came to us later. So this is just, and I'm nearly done. This is just, this was for the UK, and it shows this graph and what happens to this, this graph of the peak. So this is the critical care beds that are needed per 100,000 people. And if you do nothing, then you're sitting at something like 250 beds per 100,000. You don't cope with it. This red line at the bottom is the capacity in the UK, the number of beds that they have in the UK. And incidentally, in America, the reason that they have so few resources is that they basically have very little of a public health system at all. It's all in private hands. So getting this system mobilized to deal with people who don't have private health care is something that's taken time in America. This would be the modeled curve if we just close schools and universities, this green line here. You can see it dampens, it delays when we get to peak, and it slows the peak, it lowers the peak, and it spreads it out a little bit over a longer time. Here, if we are isolating cases, if we can identify and isolate cases, we bring that down. Here, if we isolate and we do household quarantines, and then here, the blue line is we just are throwing everything we have at it. So in other words, we're at the point where all the strategies combined, as long as we can do them, are what we need to do to flatten this curve. Okay, so that's where we are in South Africa. So flattening the curve is something that is what is giving what we are doing now by staying at home, and it will not stop our hospitals from having many cases. It's unlikely that our hospital system will not be overwhelmed. When the peak hits us, we will be overwhelmed. It's the question how much we are overwhelmed, how much above this line of what our capacity is, and it's not shown on this graph, and how much we need. Okay, so it's that difference between what we can cope with and how much more we're being taxed with. And of course, if we needed 10 times the number of beds and the resources and facilities than we have, then we're going to see 10 times the number of deaths. If we only have 3 times the number of, it's about, if our resources are only a third of what we need versus if they're only a 10th or 100th of what we need, we'll be saving lives. And we won't feel that saving of lives for a good few weeks yet. We won't even feel it. In fact, I would predict that we may have an increased extension of the shutdown. All the plans that are being made are for distance learning or for trying to do our containment strategies. And of course, that might mean that we see outbreaks throughout the year, but at a lower level and at a level where our health systems can cope to some extent with them. I was going to finish with the president.
Fellow South Africans, this is the most definitive Tumamina moment for our country. I have great trust that our people will respond positively to this call for common action. This epidemic will pass, but it is up to us to determine how long it will last, how damaging it will be, and how long it will take our economy and our country to recover.
Okay, so there we go. So I think just my one last thing to say is that when we're in the middle of something, and I think there are some pieces of writing on it, for people who have been in the middle of the SARS epidemic or Ebola, it feels like there's such uncertainty about when it's going to end, what we need to do to make it end, how we need to behave. But all of those communities look back, all of those countries look back, and it does end, and you do come out of it. So, there is a progression of the disease, and it has a start, and it has a middle, and we're not in the middle, but it also has an end.
Thank you very much, Jody. I wonder if it is 5:30, so if any of you do need to go, I understand, but I thought we could also open up to any questions. Oh, sorry, I thought it was a question, but it was just somebody apologizing for their phone. Double thing, no problem. So do we have any questions? One of the questions that came through while you were talking was the virus and spreading on plastics and going to the shops, for example, and you go to the shops, you clean your hands, you don't touch anything, or the trolley you've cleaned your hands on, but then you go and pick up a box off the shelf, or you're picking up your plastic that somebody else is. Do we need to worry about that?
Well, there's a line between kind of being obsessive and thinking that everything's got the virus and being stupid. And where that line is, I'm not sure. The answer is to wash your hands frequently. The answer is to wash your hands, 100 times a day. Because, and certainly to try to, how many of us do this all the time, or, sit like this or whatever, is to try to be conscious of where your hands are, and to not to touch your face, and to wash them, and to wash them, and to wash them, and to wash them. And I think that, and then particularly be conscious of, if you're walking up a staircase, don't hold on to the handrail. If you can, open the door with your elbow, that sort of thing, because those are the places, so think of all the places where hands go. It's probably, there are probably fewer hands going onto that packet of rice that you're getting off the shelf than the door that you press to go into the supermarket or whatever.
Christelle, yes.
I would just want to say, I think that's been the most difficult thing for me to navigate, is that middle line, because one day you're getting messages showing how to disinfect your groceries. I'm like, I've just washed my hands more times than I've ever done in my whole life. And now I'm realizing I've got to create a zone where my groceries need to go after they've been disinfected, like washing my oranges with soapy water. I don't even know if that would be healthy, and certainly the anxiety that comes with that. And I see that in our groups also when we discuss things. I think it's useful to kind of get back to that, what we can control. And I've loved the fact that for my children, there's a lot more awareness about why I tell them to wash their hands before they eat, and why not to touch the stair rails and things like that. And for me, that's useful. But I absolutely, I've actually stopped watching certain videos because the media frenzy for me is not healthy for me to kind of sit with, and the anxiety. So it is that constant thing that I think we have to take care of for ourselves, which is how do you convince yourself that you're doing as much as you can and remaining sensible, while remembering that you can't control the whole virus and the spread, So some of what you shared was really useful around that. Thank you, Geordie. I thought
I will also share some text of people who have been in lockdown. So Wuhan province in China, for example, is still largely in lockdown, and how people have coped with that, and how one of the things that has been coming through is, is try not to overdose on social media and on things that are just going to freak you out. I think that curating really interesting pieces that are more factual, or that are not so much to do with the facts and figures and death rates and infection rates and that, but also human stories about how people are managing with the illness. I read a really interesting post, which is on my Facebook page, around a South African doctor who got the virus and how they dealt with it in their house. So to deal with you feel terrible if you're quite sick. Some of you, some people won't feel terrible, but she felt terrible. And her husband came and sat in the room at a far distance, keeping isolation and being very careful about that kind of the viral spread. But just having him there for half an hour every now and then was something that was really important for her needing to get well. And so, for people who are in small spaces where you can't isolate somebody who's ill in your home, can't be isolated, then one of those things need to be, you need to think about how can you still speak to, have connection with somebody, but also manage it so that you support them and that you don't spread the viral load. It is really hard.
Yeah. Thank you.
Do you think it's, do you have anything to say on the viral loading, or just on that point? So if I'm touching something once and I maybe get a bit of an infection versus I'm exposing myself to somebody who's infected all the time.
I've been reading a little bit about the notion of viral load. And of course, there is a threshold at which you want to, if you have one coronavirus particle on you, your body will probably react to that and fight it off. So there is something about the viral load, but it's very uncertain. And so, you can imagine all the epidemiologists are busy like churning the data, and they're all busy and really interested in like the mechanics of this illness. It does seem to be that it's not like you need a certain viral load. So that's why people who are asymptomatic, they are about 50% less infectious than somebody who's like coughing and spluttering all over you. And that's because there's not, they've done in the tests for the virus, when they take swabs, that's actually what you call the viral load. Some people are carrying a lot more virus per particle of spit or whatever than others. But the threshold virus in you will be less if people are carrying, you need a threshold. So.
Cheryl Gang has two really good questions. The one was about, as the government says, only 80% are likely to show the symptoms, and this kind of ties into what we're talking about now, whereas 20% don't. So could those 20% be part of the reason why COVID-19 is spreading so rapidly?
Absolutely. And that's also when you look at the death rate. So it looks like the UK has quite a high death rate compared to the number of people who are confirmed to have the infection. And that's leading some epidemiologists to think that in fact the infection is much bigger, that a lot of people have been infected and are just carrying it unbeknown. So, unreported, because you don't actually feel that sick and you think maybe I've just got hay fever or whatever, and you don't go and report it. Here in South Africa, incidentally, if you suspect somebody has the virus, you are legally obliged to inform the authorities. That's one of the regulations there's the number. You can say, I think my neighbor seems really ill. But of course, they're going to ask questions, because you're not going to get ambulances driving all over the country going to, inspect your neighbor who maybe you just don't like.
The second question she had, and maybe this will be the last one unless there's any last questions that want to come through, but has the government in South Africa, or I don't know if it's South Africa specifically or globally, done anything to protect the people that are high risk? So is anything to try and help them?
There's no prevention. So the only thing at high risk is the government's, insistence that people isolate. So I know that some people have criticized this kind of lockdown approach, which locks down, say, my whole family together with my gogo in the in the corner there, and now we all are together, and one of us has it, we're all going to get it. And whether it wouldn't be a better strategy to but what are you talking about? Taking all the old people away and putting them on a ship somewhere, isolating them. So these are difficult choices that people, that governments have to think about. But personally, individually, we can also think about, So I won't visit my mom, for example, even though I'm perfectly healthy, but and before the lockdown, obviously, but just because I would drop food at her door, and she's not going out at all. So that I know that some people have thought about whether their mother or their granny is going to go back to the Transkei or to the Eastern Cape, where it's safer, but then on the other hand, they don't have medicine or access, so easy access if you're in a rural area, and you get sick. What are your prospects? So these are all hard choices, and there's no easy answer to them.
I guess perhaps the government making the choice to put countries on lockdown is probably one of their biggest things, because, as you say, the majority would be fine if you're young and healthy, but it is protecting those high at risk. That's the reason for one of the reasons.
Yeah.
I think.
Yeah. I just wanted to correct something, that the asymptomatic, then the percentage of people that are asymptomatic, we don't know that at all. That 80-20 statistic that Tebogang was referring to, that is of people who get infected. 80% will just have a light illness. They won't need to be hospitalized. They don't need to, those people should ideally present themselves for testing, just because we want to know, like, what it looks like in the population. We want to know whether we are getting immunity in the population and so on. But it's only 20%. So out of 100 people, 80 come through. It's minor, or you feel a little bit dreadful or whatever, or you even feel very dreadful, but you don't need to go to hospital. 20 need to go to hospital of that 100. And of those 25 probably need to go into critical care. So it's around 5 in 100 who are going to need critical care, need to be on those ICU respirator beds. That's why we want to flatten the curve. And of those 5, at this point, we don't know. And of course, that mortality rate is a very difficult thing to pin down. But people are putting a number of, like, between 1 and 2%. So 1 or 2 in 100 are likely to succumb. And of those 1 or 2, the vast majority of them are going to be old people.
Lisa asked about, or made the comment of, in some of the poor communities with poor sanitation and poor health and poor care services and all that, should the government not be doing more to educate those areas especially? And I guess that's one of the things that they're trying to do with the app. I don't know if you've all seen that there's that WhatsApp number that you can message. You just say hi and it's got information on it. So use that, I would say, is a good one. The websites, if you've got the Moya app, which is also a free app once you've downloaded it, it's data free. They've also got coronavirus information on there, which comes from the government. So hopefully that can help spread the word. But that also goes into Ntanko, who asked the question about what can we do apart from creating awareness. And I guess that's a little bit about, we can be a bit viral in ourselves, and as we know, how can we spread the word to more people and get them the right information that they need and help them to avoid spreading the virus. So I don't know, Jordi, do you have any comments on what can we do apart from awareness?
Yeah. So, I've been trying to find out around how we can get involved. And the one, obviously, resources that people are talking about. The other, obviously, is you are taking action by preventing yourself from being a vector for the virus. The other thing to know is, if you do have the virus, if you do get the virus, and some or most of us around here might get it, and you recover, then you have some immunity, and that's when really going out to help and to find, and that might be your local civic or a street committee or a ward councillor or whatever. I know in Khayelitsha, my daughter was telling me that they are calling for people to supply water tanks. There was another question about, facilities, to supply water tanks so that people can wash their hands more so that resources are more available. But actually, I think that the main reason that Ramaphosa called this lockdown and has mobilized the army around it is precisely because if we don't act now, the chances of it moving into areas that are very overcrowded and where people just physically, it's easy for somebody who's got a tap, hot water and everything in their, in 4 rooms in their house to keep on washing their hands. And it's not easy for somebody who has to either go to a stream or go to a communal tap and that kind of thing to do the washing. So my suggestion has been to, help people with buckets or jugs that they can use to keep washing, to really try to prevent old people from going out or from even leaving a room, and to try to get that information out that, an old person should just really stay in bed and have somebody pass their food to them through the door. And if we can do that, it will be, it really, I think our most valuable role is around making people feel that this is real.
Yeah, something to take seriously. I am conscious of time going, although I know Topo Gang has asked another good question about the 2 that have recovered, or 4 that have recovered compared to the 2 and what's happened. I was wondering, Jordi, could we have people message, they can send us messages directly and we can...
Yeah, absolutely. So, so the government is really still tracking everyone who's got the virus. So that unit that I referred to earlier, they, if you test positive for the virus, they are tracking you and they're monitoring your recovery. So they are keeping as many stats as they can on, and that's really important for their decision making, right? So that's how we can say 4 people have recovered. Yeah.
So what I've put in the chat box my email address, and@rootstoresilience.org. If you have more questions and would like to continue the conversation, send those questions through to us on email, and then we can work with you directly, because I do like to just accept that we had said an hour. I know we've gone over time. Thank you very much. I'm glad you're enjoying the conversation enough to want to ask more questions, but we can take that on a one-by-one.
Thanks, guys. For those Go for Golds who haven't used all their data, it's only for 24 hours, so download movies and use it up before it closes.
Great. Thank you very much, Jordi. It was
Thank you,
wonderful.
Jordi.
Pleasure. Thanks a
And
lot.
there were a few comments to say thanks for the lily pad thing. That was also really helpful.
Yeah.
Wonderful.
Cool.
Take
Thanks,
everyone.
guys. Stay safe.
Day 2 of lockdown tomorrow.
Thanks.
Bye-bye.
Bye.
Bye.